Hi guys, my name is Brianna Jasmine Hernandez and I will be giving you guys a speech on lupus. Lupus is more than just a rash. Recently in 2017, Selena Gomez went under surgery to get a kidney transplant from her best friend, and from there people just kind of began to research what lupus was to have a better understanding what the pop singer was going through. Lupus affects your skin, your joints, and your body organs. With lupus, you do have a really weak immune system. With that being said, that means that you don't really have any antibodies, which are proteins, to fight off any foreign infections that come within. With that being said, you get sick often, and it's just really hard to fight off infections. 1.5 million Americans have lupus, and at least 5 million people in the world. Also, 1/3 of lupus patients have multiple diseases. With lupus comes a butterfly rash. With that, you can either have a minor case, which is just something really mild, or something extreme, which becomes blisters. 4 types of lupuses are systemic, which is 70% of cases, which affects your heart, lung, kidney, and brain. There is cutaneous, which is 10%, and it only affects your skin, which means you get rashes all over your body, mainly your face. And there's also the drug-induced lupus, which is 10%, and it occurs whenever you have high dosages of medication within you. And sometimes whenever they lower the dosage, the lupus can leave, or it'll stay with you and it'll just get worse. And the most rarest one is the neonatal lupus, which is when babies either are born with rashes, liver problems, or just breathing problems in general, and it disappears over time. A personal example would be that in 2016, I was diagnosed with rheumatoid arthritis, and I was undergoing a lot of medication just to kind of figure out what would help and what didn't help, just to kind of see what my system was like. So they gave me this medication called Enbrel, and it was 6 shots every week for about a year. And the doctors running some blood work found out that that was giving me some symptoms of lupus. So they stopped giving me Enbrel, and the lupus went away. And then we figured out that the lupus was coming back, and they weren't sure what was giving it to me. So they thought it was stress. So then I went to therapy, and it wasn't stress. The doctors told me there were 7 main symptoms of lupus, and I only had 5. So with those 5 qualities, I needed 2 more. And from 5, I'd go to 3, then 6, then 5. And finally in 2018, in February, I was diagnosed with lupus. And with that, they told me to change my diet, a way that I work out, and just kind of things that I do every day, because one day I can be fine, the other day I won't. With having lupus, I have also had really bad days where it's flare-ups, and it can either portray my arthritis just being bad, or it can be my body just shuts down. I can't walk, I can't move, I can't really do anything on my own, and that's just kind of with my lupus. Over $20,000 are lost annually to every single lupus patient due to healthcare and lost productivity. And it can also take up to 6 years to get fully diagnosed with lupus. Lupus is not always hereditary, but if you do have it, it is pretty common to have someone else in your family with it. Also, just so you know, some triggers are sunlight. That way, you should always wear sunblock with SPF 60. That way you're safe and protected at all times, even if you don't have lupus. You can also be triggering it by having an infection or just random medication. So, risk factors. They're common to women. Usually you get diagnosed with the age of 14 and 45. And the common race is African American, Hispanic, and Asian American. Always remember, never diagnose yourself. And if you have any questions or concern about your health, call your doctor.